All right. So yes, we are trying to do this hybrid style. So that's why it's been a little, we're trying to figure it out to meet everybody's needs. So welcome. Thank you guys for being here. Yes, there's donuts and coffee on the way. Sorry, folks, that are online. You don't get any Krispy Kreme donuts, but we'll have some for you. So yeah, again, thank you. This has been a training I know that's been asked for. And so Kourtney and I really hope to answer some of your guys' questions today. I think one of the caveats just to start with is that this training is not intended to make you guys licensed addiction counselors, right? You guys aren't going to come out of here and be understand. We don't want to get, I guess, too far into the weeds when it comes to the drug testing results, because that's really not our role. And so, but we do hope to give you enough information to understand what you're seeing. As you guys know, probably 95% of our cases involve substance use. And so I'm guessing almost everybody in this room is on a case that has UA results coming in and like, what do I do with these? What do I not do with these? So our goal here really is to answer some of those questions for you guys today. So we have to go down.
For those of you that don't know, because there's a few faces I don't recognize, I'm Kourtney Brown. I've worked here for about a year. Before this, I was in LAC, which is why I'm part of this training. But yeah, welcome, and I'm excited to see new faces.
Yes. Okay, you want to go for the goals? You want me to go with that?
You can do that.
Okay, so I kind of already hit on this a little bit. We really just want to give you that foundational understanding of drug testing. Like, so we're not going to get too far in the weeds. That's not, like I said, that's not a CASA's role. We don't need to dissect the UAs. We don't need to understand all the nuances of the UAs, but just have enough of a general understanding of the drug testing. We are going to talk about more how to interpret the results in the context of child safety. So you're really going to see most of the second half of the training is going to be more about, okay, what are the behaviors? What does this mean for the child safety piece? Because that is our role as CASAs, right? Advocating for the best interests. And one of that is safety. Are they safe? Are their parents safe? What does that look like for your unification? And again, focusing on behavior and progress. And I like to say, not just chasing the P. And so I've said that really from the moment I started here. So I know it sounds funny, but if we're always chasing the P or the UA results, we're missing the point of what is the behavior change. That the P doesn't always tell us what we need to know. And so that's what Kourtney and I were going to get in, that we're going to get into is, okay, what does the UA tell us? And what does, Sandy's in there waiting for you too. Sorry. What does the UA tell us and what does the UA not tell us? And so we're not going to be chasing the P, as I like to say. Okay.
Different perspective.
Yes, it is a different perspective. So keep it up and pushing that. Okay.
It's tiny.
I'm sorry.
No, it's okay. Okay, so there are a bunch of different test types, which I'm sure you all have heard of most of these, but maybe not all. So the first one is a UA. That's just your basic urinalysis, where someone usually pees in a cup and then it is tested in different formats of a rapid testing. It is 1 to 7 days, variance by substances, of course, and it's the most common.
So can you tell me, like, what does that mean, Kourtney? Like 1 to 7 days?
So that's the detection window of how long your analysis will go. That's just your basic, but then you've got your ones that do alcohol, and those ones go longer. So that's just your basic UA is 1 to 7 days, but that's also different because all your different substances stay in the body for different amounts of time, depending on your metabolism.
Okay.
Do you
So
want me to
some
go further into
that's
that?
okay. I'm just gonna ask you clarifying
Why
questions.
did you say alcohol?
Yeah, so
Stays in your system?
they can have an alcohol test. I want to say it's up to 72 hours. Correct me if I'm wrong if anyone knows in here. Yes.
Mhm.
So, yep. There's a certain thing they'll add to the UA to add those on. I cannot remember.
So if somebody is using methamphetamines that I used a week ago and I took a UA today, it could still be in my system.
More than likely, no.
Okay.
Methamphetamine is about 3 to 4 days max. And again, that depends on your metabolism, but yeah, meth is a pretty
Okay.
in and out.
Okay. So that 1 to 7 days really then varies by substance. Some of
Yes.
them, if I don't get tested right away, it's going to be out of my system by the time
Exactly.
they test me, depending on what I'm drinking, what I'm eating, my metabolism, and then what the drug is.
Yes.
Okay.
And most drugs are in and out. It's within, few day period. It's not much longer than that, other than marijuana. Marijuana can stay in your system anywhere from 3 to 6 months, depending on your body type. Yeah.
Okay.
Okay, the next one is the patch. I believe a lot of people also will be familiar with this one because I know a lot of clients are on it. the continuous use of over 7 to 14 days, and then they'll change the patch and they test it when they change it. It detects ongoing exposure and it can be missed if tampered. So if you try to take it off, I know that if you're in a room where someone's smoking marijuana and it's just the clouds are in, that'll detect it as well from being on there. And that one does your sweat. That's how that gets tested, if anyone didn't know that one.
Why would somebody be put on the patch over a UA?
UAs can, number one, be deceitful because so many different things can pop up, and the patch is just a little more precise. Also, UAs can be tampered with. There is a bunch of ways that UAs can be tampered with that a lot of people don't know about. But they'll attach something to their thigh with fake urine in it. They'll
You can purchase fake.
Yes, you can purchase fake urine anywhere. You can go a block or two and get it anywhere you want. Yes. So the only thing with fake urine though is that will only pass on a rapid test. That won't pass if it gets sent out. Because there's something that's not in it that's in our bodies naturally, and so they know immediately if you've used that. So that only works for rapid testing. But yes.
Fake urine's not somebody else's.
No,
urine,
fake urine
it's
is
fake.
synthetic urine. Yes. If you buy it at the store, it's synthetic urine. It's not actual urine. Barb, why? No.
Walgreens, it's very bad.
Knock twice, special knock.
Behind the door.
Knock on the pharmacist door.
They can go to any smoke shop and it's completely yeah. So anywhere that sells tobacco products usually has synthetic urine. It's yes, synthetic urine is not illegal in itself. Obviously, if you're using it for your drug test and you're tampering with your drug test, if you are caught. And then other people use other humans' urine. So that one's actually pretty common.
Like tape it back to your leg or something.
Yep. Girls will. Yep. Men, I just know tape to the leg, sometimes it's in the bosoms and they pull it out. Obviously that doesn't work if you're being watched. But yes, and then I've seen a lot where they use their children's urine. So that happens.
So I think one of the things I've heard in court a few times too is like if someone is not able to go in and UA on a regular basis, is that also another reason they put them on the patch?
Yes, so we have a couple relevant right now where the gentleman works out of town and comes back and forth. Obviously, how are you going to UA like that? You can't UA out of state and in a different state. So yes, so people who work out of town, they'll do the patch for, and there's other reasons that they do the patch. Some people want to be on the patch. It's easier. It's not an everyday call in and having to think about that. So yeah.
I noticed on one of the reports that I got back, it said something about dilute.
Mhm.
And that basically means it's been messed with.
Yes. Dilute can mean, in a UA particularly, dilute usually means that there's too much water in it. Either the person was drinking too much water, which if you're drinking an excessive amount to where it's diluted, it's because you're trying to drown out your system. That's used a lot with marijuana. And then, yeah.
Is there any way for them to detect a child's urine versus an adult's urine?
Not legally that I know of. No.
They have to get the child's urine.
No, so some parents use the children's urine as their.
But that's not detectable.
No, not that I know of. And I don't know. I think it's more of a legal thing than anything because when you get it sent off, I don't even think that they're allowed to test for that. That's not a thing. So just like they know like if a woman is pregnant or not. So if there's a man using his girlfriend's pee and she happens to be pregnant, but again, I don't think they're allowed to know that information, so I don't think they're allowed to comment on that. But I know that is different. So
The first time I'd seen that was what's the book that J.D. Vance wrote about?
Yeah, the hillbilly, yeah.
Elegy. That movie was the first time I'd seen that. She was using her son's urine for her testing.
yeah. All right, next one, breathalyzer and scram. These are also really common, especially with people who have more of alcohol issues than they do with drugs. CPS, will come in and test right away, but if you're passing them, then you don't have to do them usually. So breathalyzer is just straight that, it's your breath, it's alcohol. That detects, I don't know the amount of hours, but I know it's within hours. And then scram is the ankle monitor that detects for alcohol through sweat. They will put a lot of people on that who do any type of DUI programs. And again, these both only test for alcohol, and scram is one where, let's say they decide to go out to the bar with friends, someone spills a drink, someone does anything, touches them too closely and their sweat has it, it will detect that as well. I've seen them get caught like that quite often.
Does the scram keep track of their location also?
If GPS is on it, so I think there's some. Sorry.
Yes, yeah.
So sometimes
No,
she'll be on an ankle bracelet that'll do both. That'll do
Yes.
the testing and the GPS, and then sometimes it's just the sweat testing. So
Yeah.
it depends if they're on a GPS ankle monitor as well.
Yeah, because they're not gonna put you in two ankle monitors.
Yeah. Yeah, two
Yeah,
ankle
that
monitors.
yes, I have seen that. I've never seen that here, but I have seen that.
Yeah.
For my particular case, it's a young guy and he and the girlfriend got pregnant with this little boy when they were like 17. Anyway, he's in his 20s now and he's doing really well. He's in family recovery court, but he's blown off a couple of drug tests because he gets full of himself. So fair put him on scrap. But no more drug testing for you.
Yeah.
So he's put on instead about that, but
Yeah.
that's life. You don't do what you're supposed to do.
Yep. And then that's a lot of responsibility because if you let that thing die, they don't like that.
It's not just that, but on top of it, isn't it a lot of money for these things too?
Yeah, they're expensive, they're heavy, the showering aspect, summertime, just walking around with that is just, yeah.
And does the client have to pay for it?
Yes. Yes.
Do the drug court?
No, I don't think recovery court would. No, absolutely not. In a criminal case, yes, they would pay for it. Okay, saliva, that's more recent use, and that's 1 to 3 days, less invasive and a shorter window. I don't see this one used too often other than with kiddos.
They typically do hair.
Hair.
Mhm.
Okay.
Mm-hmm.
I've seen a couple saliva ones, but yeah, mostly hair.
With breathalyzer, I think I've seen also that there's been times when the unit was in the car and it's been too cold and it won't register.
Huh. Is that to start your car? Is that a different thing? So they also have it where if you've had multiple DUIs or certain insurance, if you have to get like an SR22,
Yeah, that will.
then you actually have to blow into your car to get your car to start. That's probably what.
But yeah, being too cold to
what you're
use
seeing.
is probably
Mhm.
one to-
But yeah, they'll actually have like the little breath remote starters where you have to actually blow into it before your car will start.
Yeah, and that one's super touchy. That one, if you have mouthwash, very touchy.
And what does the saliva test detect?
I believe they can test for anything with saliva. The most thing I've ever seen it used for is marijuana, is a quick marijuana use.
I really haven't seen it used here.
They used it a lot when I worked at alternatives, and that was about the only time I saw it, and it was always usually for marijuana.
Interesting.
Yeah. Okay. And then a hair follicle test. This is long-term use, up to 90 days, and shows patterns, not immediate use. So we see quite a few of these with the kiddos, of course, when they get tested. And that level means a lot of different things. So depending on their hair follicle level, they can tell if they've just been in the environment where it's been used or if they've actually ingested it. So that kind of sets up the severity of a case. Any questions with hair? Okay, what to look for in drug test results? Consistency. Are tests happening regularly? Are tests stable over time or do they fluctuate? Gaps in testing can matter as much as results. Patterns or trends, moving from positive, negative, or vice versa. Increasing or decreasing frequency of use. Any sudden or unexpected change. Type of result. Positive, substance present at time of testing. Negative, substance not present, but not proof of sobriety. Dilute, invalid, inconclusive, considered positive. Missed tests look at patterns and reasons, not assumptions, but missed tests are usually also considered positive in most scenarios.
We were having this conversation, was it you and I, about when you were looking at some of the family court people and it showed only 10 days of sobriety?
Oh, yeah, yeah.
And is that usually because it's a missed
Yes.
test? Or
Mhm.
it's not necessarily that they went out and used, but they either missed a test or it was dilute or something weird.
Because like,
Yes.
any missed test is a positive test.
Yes,
Correct.
especially in
So
drug
that's
court.
what Jen was saying to me.
Yep.
Yeah.
And so the judges usually are pretty good about looking at that and being like, okay, yes, this says 10, but this is how long sobriety they have that we know of. These ones were missed, excused, kind of whatever.
Yeah, so you'll see too, like I said, yeah, I think it's usually the mist and then also a lot of times if they're dilute, right? So sometimes they may not meaning to dilute it, like, water it down, but sometimes they are. And so, yeah, any kind of really messed with, any of that tampered with is going to be considered positive in the eyes of the court.
Because dilute can mean quite a few different things. The two that I know of the most is the over drinking of water or tea or whatever they choose to use, but also the overuse of niacin. I don't know if that's as common anymore, but that used to be extremely common for people to just down a bunch of niacin, burn it out of their system so that they can then pass their drug test, which also can dilute it.
But that's detectable.
Niacin? No, because you already have niacin naturally in your body. Most foods have niacin in them. If you look, you're just putting a lot into your body all at once. And it's overheating your system and it's drowning. It's really bad for you, but they do it. And yeah, and you'll know if they did it because if they have to give themselves like 24 hours before they test, because I mean, they're bright red, they're sweating, they're uncomfortable. It's, yeah, not.
So you would like on a UA though, it would show dilute if they've drank too much water.
Yes.
Right. So,
but then,
so
and
that
then it
would
could
be
show,
detectable.
yeah,
Yes.
and it could show dilute for the niacin. It just wouldn't
Correct.
be detectable that it was niacin.
Right. So it is going to show dilute, or they're going to be looking at certain, different other numbers. It's going to show that they were probably trying to dilute the UA.
Yeah, there's people that have like dipped their finger in bleach and then tried to dip it in the urine because someone on Google said it works apparently. So yeah, there's a lot of different things that will go into a dilute like that.
And then there's what always gets me is the excuses.
Yeah.
Yes. I obviously.
Yes.
I Costco often.
We'll get into,
But another one that I saw that was interesting is I had two cases. One of yours, or one of your advocates. Yes, explain that one.
Okay, so Noelle's mom does regular testing, but she is on a medication that's supposed to help with the addiction. But when she tests, that one only shows up like every so often, but really high. But then for the next few tests, it doesn't show up at all. So
Is that
like, is she using it wrong? Is she using?
Yeah, and we actually will be going into that.
we're going to get into that here in a little bit.
Yeah.
I have another one who it keeps testing positive. It looks like it's for amphetamines, but she's on ADHD medication.
Yes,
we're going to get into that.
Also going to get
Yep.
I mean, it's
Yeah.
So the detection. Oh yeah, go ahead. Sorry.
What frequency are they testing? Are they testing
At CPS?
monthly?
It's all over the border. It just depends on where they were at when they were removed, the parents, like what the situation was, and then what the needs are after that. So
yeah, so you're going to see, are they on the scram or are they on the patch, right? Because that's going to look different than if they're on random UAs.
And random UAs, it's not set in stone. It's literally a number that you call and it's a random chosen. Yeah. And you usually don't go more than 3 or 4 days.
And I think that's where we really struggle with chasing the P, right? I personally feel like, yes, like sometimes like we're over testing and we're relying too much on the UAs and the results. If kids aren't in the home and they're visiting, why are we testing 5 days a week? That doesn't make sense to me if the kids aren't in the home, right? Because all of that costs taxpayer dollars, right? CPS is paying for those UA tests.
Very expensive.
And so, yeah, so sometimes they're relying too much, I think, on those UAs sometimes. To make decisions or determinations when it just doesn't make sense. And so that's what we're going to get into here in a little bit too. What should we be looking at? Not just always those UA results. Because that's, a snapshot in time. It's like, as you're hearing, it's so many ways it can be tampered. It can be, it's just, that makes sense. So.
May I ask a question?
Yeah. Yes.
Yes, to me? Okay.
Yes, yes to you.
So you're talking about overuse of scheduling overscheduling UAs.
Yes.
What is the psychological impact of knowing that you have regular UAs scheduled versus knowing that you can be randomly given a UA at any given time? Is there any sort of documentation as far as is one more effective than the other, less effective? I mean, aside from the taxpayer angle.
Yeah. You want to answer that?
Yeah.
Gina?
I would say neither one of those can be a factor or they can be huge factors. I think it depends on the person and where they're at in their sobriety. I do agree that those frequent ones are a good way to give them responsibility and things to do because that's the biggest thing when someone's newly sober. The minute they get bored, what do they want to do? They want to use. So giving them those responsibilities that they didn't have before that are kind of quick and easy. You call this number. If it's yours, you go in. And also then that accountability piece of staying sober. I think sometimes maybe those once a month ones is too much pressure on them personally. And I think that can cause issues too, if that makes sense. But that's just from my own personal experience, how I would say for that.
Yeah, does that make sense? Denise, I think, yeah, it is going to be, yeah, where they're at in their recovery and their sobriety, what kind of testing they're on, probably what substance they're on. I think that's the hard part with all of this, right? Is it's so person dependent, substance dependent, where they're at in their journey dependent, that it's not a black or white or in this box or in this box. And I think that's why it's such a struggle for folks, right? Because it just looks very different for everybody. What does their support system look like? What is their, do they have their basic needs met or do they not? And so I think it's so dependent on the person and the situation.
So then what is the
makes sense.
Sorry. What's the reason for you for relying on UAs then? If it's so individualized and so dependent on the individual, I mean, is there is this the best way to keep track of people's sobriety?
Well, and we'll get to that, Denise, here in a little bit. I mean, I think there's a purpose for it, but I also think, yeah, that's kind of really the point of this training is how do we see beyond, how do we look beyond it and not just rely so much on the drug testing. So hold that thought, and I promise I'm hoping we'll answer that here in just a little bit for you. Okay. Anything. So I think really, I mean, I think to summarize this slide, really, like I said, again, there's so many variances in this, right? How often are they testing? Yeah, are you seeing positives and then negatives for something that should be showing up in their system the whole time, right? We talk about gaps, right? So again, we're getting it into, okay, why were there gaps? What's the story behind the story? Yeah, are we patterns or trends? Are they always positive and then all of a sudden they're negative or negative and then positive? You guys will remember like a few months ago, we decided like, hey, unless there's something different or changed, we're not going to be uploading all those UAs all the time, right? If they're always negative, okay, all of a sudden now there's a positive, right? We need to pay attention to that. Or they're always positive and now they're negative. Those are the ones that we're paying more attention to because something has changed. The pattern has changed. What's going on? Yeah, so really just looking for those changes over time. And like, yeah, type of results. Substance present at time of testing, negative does not mean that they're sober, right? So you just heard there's other ways that they can be compromising their P test. So
and there's false positives.
Yep. So we'll get into that too. So
well, Carrie, in that case though, where you're not uploading all the negatives, is there a way the advocate can know that there have been 10 negatives and now suddenly we've got a positive? Because the advocate might think, oh gosh, this person hasn't tested for all this time.
Yeah, so it's usually when they first are starting, like if we've had a pattern of negatives uploaded and then it just continues, then we're not going to. But then the first time I see a positive, I'm going to say, oh, Bob, you need to pay attention. I just uploaded a positive test on this.
But how do I know how many negatives there were prior to that?
So every single one would be negative. So if we're gonna,
but how do I know? I mean, if it's random,
like the frequency.
Yeah. How many?
I personally put it in the contact logs, and I'll put a note in there that say Mary tested negative from 11/11 to 11.
So that's how the applicant knows.
Yeah.
From reading your contact.
Yeah. So instead of uploading each one into the document section of Optima, I'll put a note in the contact log.
Yeah, like some of like Joanne, I know she's on, like there's one there that we've been really specifically watching a dad on her case. And so on that one, I am uploading those ones so that we can see, okay, he's continuing to test negative, which is a big indicator on that on that case for us. And so kind of case dependent, especially again, when they're UAing so frequent and so often, yeah, just had kind of made that decision that, okay, yeah, they're going to keep testing negative, which is great, right?
Especially if it's a case where they're close to reunification.
Yeah.
And mom's been sober for 380 days. So this isn't anything out of it. I mean, it would be very unusual if she tested positive, and in that case, I would send an email to the advocate, the peer coordinator, going, holy cow, look at this. Do you know, has anything changed or any idea what's going on?
All right, over the counter and prescription drugs. These are things that can pop up as false positives. I know poppy seeds is huge contradiction. I know that if it's certain kinds of poppy seeds, which is more like homemade, that can pop up as positive. Grocery store ones, I don't believe it's enough. Ibuprofen, Sudafed, some antidepressants, some antibiotics, and
I spelled it wrong.
you did, and then that messed me up.
Antihistamine?
Yes, and sleep aids like Unisom. ADHD meds is the biggest one that will pop up as a positive, and that can pop up depending on the different kind as LSD, amphetamines, or methamphetamines. So.
And if somebody is taking ADHD medication, is there another test that can be done that to test if they're on amphetamines?
It's pretty easy to tell from the medication and the dosage if they're taking it correctly, if that makes sense, as opposed to if they went and used that level. And not only that, but if they did feel, there would be other signs, obviously, if they were doing
a difference in the degree of.
Should be, but not always. That's the hard thing about these kinds of things is there's never set in stone. It's kind of everything kind of fluctuates.
A lot of times they have to get permission. With the mom's in one of my cases, she's in family recovery court, so she had to get a note from her doctor stating that she was on this particular type of medication.
And that's because before they did not allow ADHD medication for recovery courts and for other cases too.
And when the report comes back, it says negative for this, negative for this, negative for this, positive for something else.
And you can look at the level.
Yeah.
And so if those levels are staying the same, it's obviously and the person has disclosed that they're taking ADHD medication. If you're seeing that same level across the board, then you know that they're regularly on a medication. But if you're seeing, spikes of this and that, then it's obviously
random news.
So I think that's something, it's a good question, Bob, as far as like if they're on medication. One of the other things too is like when you are taking regular UAs, you have to provide prescriptions that you're on. And so that the facility testing, they should have a copy of all of your prescriptions that you're on. So they would know that, hey, I'm on this medication. And so they know to expect to see that come up positive every time. Now, if they're not providing that, then that's the issue. So
for those of you that are virtual, that's not going, sorry. Can you hear the discussion around the table from the other people besides Carrie and Kourtney?
Yes.
I can hear some of it. Some of it's pretty muffled. Articulation and projection would help.
Okay. We'll try to repeat the questions. Thank you.
So I think, again, the main thing, like I said, it's not our job to analyze if they're taking these things. This really comes down to the drug testing place, to, their drug and alcohol provider. Does this justify? Does it make sense? Are the levels okay? That's really not anything that we should be too concerned about or be looking into, because we're not the experts on how to read these and to determine, like, are they taking the right level or dosage, right? And would that equal this on their testing? And so, but being aware of that, or if you're hearing like, okay, like you're on a medication, make sure you provide that, right? Make sure your caseworker knows that, or if you're in recovery court, you have to get permission, or make sure that the drug testing facility is aware of that you're on that prescription, then they'll want a copy of that. And I know this is really text heavy, so you want to simply go over, like, basically kind of go over what MAT means?
Yes.
Okay, you're going to hear Matt.
MAT. So medication-assisted treatment is a comprehensive, evidence-based approach that combines the use of FDA-approved medications with counseling and behavioral therapies to treat substance use disorders, primarily opioid use disorder and an alcohol disorder. It addresses the physical and psychological aspects of addiction to support sustained recovery and improve overall quality of life. And then those are the 3 different kinds that they can be on. And I know we have quite a few in the recovery courts that are on. This is something I know a little bit about, but not too much. So I'll kind of just leave it if you guys have any questions about Matt.
I did have a young mom who, at the time of her children's birth, she had twins. She was on Suboxone, but they determined that she was misusing it, and they ended up pulling those kids.
Yeah, so that's something that, yeah, we'll look at in some of the examples that we have, and that's the same thing. I think on another case that we have in recovery court too, that's where again the treatment providers are going to be looking at, are they abusing buprenorphine? That happened to be the one that we're watching too. And so yes, they can absolutely abuse these. And so that's why, typically I don't think they give out pills as much anymore because people were selling the pills on the street, right? And so most of those you can kind of see that they're going to be doing injections, implants, something that where you have to consume it and where you can't be selling it on the street. But yes, I think, MAT or medical assisted treatment is something that is a lot of controversy over. Does it work? Does it not work? Is the judge supportive? Is the not? I mean, I think there's definitely a reason for it and a way to use it. But then unfortunately, sometimes you'll see that some folks will be on Medicaid, medication assisted treatment the rest of their life in order to stay off of, the other drugs. And so I think it is something that there's still, controversy around.
Are these drugs habit forming? I mean, I've heard of people being on methadone.
Yeah, so are they habit forming?
Yes, they are.
Yes.
Because so if you think about like
I'll have you speak really loud, Alyssa.
Yeah.
Sorry.
Using a substance such as a stimulant, then if you want to stop using that stimulant, what the stimulant has done to your brain is overload it with serotonin and dopamine. And once you stop cold turkey, your synapses in your brain have nothing to grab after that. And it's really, really hard, and it can actually produce physical pain. So if you get prescribed MAT and you start taking like Suboxone, for example, those oftentimes come in strips and they're very regulated. That's where Carrie was talking about though, that those do have a street value, unfortunately. So that is kind of a hang up for it, but in order to not have such a terrible withdrawal and in order to produce more I want to say longer recovery, more sustained recovery, having a step down where it can be titrated or tiered, that has been known to have better outcomes for people's long-term sobriety. And it is medically assisted. Like, you have to go to a clinic to get these things. It is all prescribed by a provider. It is pretty rigorously watched. In my opinion, it's a good thing. And it is something that sometimes people do have to be on it for life, because we know that having an addiction to a substance chemically alters the way that your brain works. Just as having depression or diabetes or cancer alters how your body is.
Were you guys able to hear that online?
That was beautiful, Alyssa.
I'm hoping.
For the most part.
Okay, good. And I know this is probably a really bad example or analogy, but like think about like when you're trying to quit smoking, right? Like you have like the nicotine gum, you have those things, right? That you're trying to, so you're still giving your body, right? Your brain what it's been used to, but then there's also kind of that step down thing. That's kind of the way I equate, MAT is kind of like the nicotine gum. I mean, obviously in a less drastic type example, but again, trying to feed your brain what it's been used to, because like you said, it physically can cause issues.
And then 2 more things for this. I think Vivitrol is becoming really popular, and I think that should be talked about as well. So that's a shot that you get that prevents you from feeling the effects of alcohol. I believe other things too, but I know alcohol for sure. And it'll physically make you ill if you attempt to consume it. So one example I give is I used to work at the mental health center, and I worked with the homeless clientele, and we had a gentleman who was homeless, and he had severe problems with memory due to his alcoholism. Well, he couldn't remember that he was in recovery, that he forgot every day. It was a struggle to get him to remember who I was and working with him. And he ended up getting on Vivitrol, and that's what really took it off for him and really gave him back years on his life. And without that, I don't think he would have made it. And so there's lots of different aspects. And so it's really important, I think, with Matt to be really open-minded because, yeah, one person might not need Matt, but somebody else who's used for a really long time and maybe more amounts, their brain chemical and the way that it's functioning is going to be so entirely messed up. There's going to be no want or need to be sober. Like it's just going to be that just painful for them that it's just not worth it. And so this was created as a way to set more people up for success. And while I don't necessarily think it should be long term, like life or death, I definitely think, like she said, tiered, and it needs to be watched, and it's very individual. So I know, there's a lot of controversy with it, but if you really have an open mind and just kind of see different individuals and meet them where they are, I think that really helps. Like, okay, that's why they're on this, and makes it more understanding.
Question. This is Judy.
Yeah.
To be on MAT, I know it's monitored by a physician, but do they have to be attending counseling regularly as well?
They are supposed to be, yes. Is that enforced? I don't know. I don't work with that anymore, but it's supposed to be. They are supposed to be, yes.
Yeah, it probably is kind of like, like how a lot of physicians will put you on like anxiety meds or depression meds, but with the condition that you also have to be, seeing a therapist.
Yeah.
To kind of be talking through the root cause of your addiction or the root cause of your depression or the root, right? Actually like working towards the root cause of the use.
But that's anybody in recovery should be in some form of support anyways, but yeah, especially with Matt.
Well, and from the perspective of CASAs, the conditions of return to the parents' treatment plans almost always have, you have your mental health evaluation, you have your chemical dependency evaluation, and whatever the results of that are, then you have to, because it's ordered by the court, you have to do those things. So if you are given the option to do that, you will also have the other side of it, which is the mental health.
Right. Yeah. Yeah. So hopefully you heard that. So yeah, typically it's going to be part of it's always actually going to be part of their treatment plan that they have the evaluation and follow those recommendations. And the recommendations are always going to include not only your testing schedule, but the therapy schedule as well.
Question?
Yeah.
Or comment, I guess. So I deal with teenagers, not a youngster. And my experience is that finding a therapist is very difficult, and there are long waiting times. So if someone is in recovery and that's a condition of getting those shots, are there other options to explore besides just getting on somebody's wait list?
Yeah, so Denise, two types of different counseling. So typically where we see the wait lists are for the mental health counseling. This is more your substance abuse counseling with, somebody like a licensed addiction counselor. And that's going to be a lot easier. They have groups, they have individuals. So there typically is not a wait list for the substance abuse counseling. Where we see the wait lists are for the mental health counseling, not the substance use counseling. Because those are going to probably get you in a group right away. You're going to have a group, you're going to have an individual, you're going to have, whatever that looks like. And so there aren't wait lists for that. And so that's typically, like I said, not a problem for that piece. It's the mental health that we see the issues.
Okay, good to know. Thank you.
Yeah.
And I'm guessing for some of these folks, like group settings like AA and things like that, will count as well.
Yeah, so they'll typically, they'll want you to get a sponsor, AA, a 12-step, find what works for you. And I think, Kourtney can speak to that more too, that again, it's not a one size fits all, just like for any of us in this room, right? Like 12-step, we've heard, a lot of people really do well with the 12-step program. Some people don't do as good in a group setting as an individual setting. And so finding what is going to work for you.
And that's what's awesome about treatment is treatment already comes with, if you're in treatment, one-on-one plus group, because you really need both sides of that, in recovery.
That accountability.
Especially early recovery. Do you want to fly through some slides really fast so we don't run out of time?
Yes. Yeah. Do you want me to talk?
Yeah.
Okay. Okay. So testing kids. So I think one of the great things here in Yellowstone County is that if kids are removed from a situation or a home where their parents are using, most of the time, like probably 8 out of 10 times, they're also going to test the children to see if that exposure or the parent's drug use is impacting the child. And you're going to see that in that initial removal affidavit, you're going to see a presumptive positive, right? So meaning, and I'll let Kourtney kind of explain the rapid testing versus the lab testing, but they're going to test the kids. They're going to do it through hair testing. And then I'll have Kourtney talk about what the results tell us and rapid versus lab testing. But the thing that's helpful for this is that it's showing the parents, a lot of times the parents are shocked. They'll be like, oh no, there's no way my kid was positive, right? I was using out in the garage, or I only used when they were in their bedroom. Like I said, most of the time these kids are popping, coming back positive, but then it also helps justify the removal of the children because we know that drug use in and of itself is not a reason for removal. They have to show the impact on the child. They have to show how it's impacting that child. This is a direct way to show that, hey, it's impacting the child because it's in their system. Right. So not only are you using, but now it's in the child system. So just very similar to how, when they remove babies at birth, how they're testing the babies as well as the parents, and the babies are being porn positive. That's a direct impact on that child or that baby because it's in their system at that point.
And I know they do umbilical cord testing as
Yeah.
well.
Yeah, that's the normal one. So that's like the right away. And then if that's positive, then they test the baby.
Yes, you want to talk a little bit about rapid versus the lab?
Yeah. So rapid testing is right there. You see them stick something in, or they'll pour it into something else, and that's your testing right away. That's great. That's a result, but it's not always accurate. It could say negative and it could really be positive, or it could say positive and really be a negative. And this is why all positives get sent off to the lab, because the lab can test further for whether that was a different medication or this, and that, whereas the rapid is just right there, yay or nay. The ones that go into that is, again, if you're on some type of medication, some ibuprofen, some Sudafed, that kind of thing, then that's a positive, and they normally get a sanction for that if you're in recovery court. But then if you send it off and it's a negative. And so when I worked at alternatives, that was a big thing. If we had a positive, we didn't give a sanction for it until the test result came back from the lab. Just to give,
I kind of understand it the best, like think about like strep throat testing, right? How they'll do like a rapid versus they have to send it off, right, for the culture to lab, or even like pregnancy tests, right? Like sometimes you can get right, but then you have to do the blood work to actually verify. That's kind of the way I see this too.
Yeah.
And so a lot of times you'll see in that removal affidavit that yes, presumptive positive, but we have to actually wait to see what the lab says, because then what can those results tell us, Kourtney?
Tons of different things of medical history, prescription drugs, or any other drug that they've taken that popped up as a positive.
So when you're looking at the levels for kids, yes, exactly. So
yes, for the hair
testing,
testing, yeah. So the hair testing level for kids, that can tell them whether or not it was in the home. And one thing with that some people don't understand is even if they're in the bedroom and they're smoking it in the home or using it in the home, there's some drugs that crystallize on the wall and the carpet. So you've got a 2-year-old crawling around literally ingesting it. And so that goes to show if it's in their system and they ingested it, or if they're just using around it, because that wouldn't be as high as getting in their actual bodies.
So like exposure, environmental exposure versus ingestion, right?
Yes.
So that's where that lab test is going to be really important to tell CPS and us what's going on here.
And if they ingested it, obviously, what's their age? How did they ingest it? What happened? That kind of thing.
Perfect. Okay, so we have a few examples of actual UA results that Kourtney will briefly kind of go over because I know we're running out of time, but what does this UA tell us?
So this one's sweat, right? Yeah. So this one is a sweat UA, which means it was a patch, and this one is, since the name's on them, is this the one that, no, this isn't one for ADHD medication, right? Okay. So this one is a positive for methamphetamine, and this is an actual positive. So this is someone whose sweat tested positive for methamphetamine, and it was a certified positive. Do you guys have any questions about the
certified?
This, so that it was meth, it wasn't another drug or something, if that makes sense.
So then,
whereas,
you're saying that the company that tested it is certifying that their result is correct.
Yes.
So this would be the lab result, right? So this has been sent to the lab. That's why you have kind of your values, your numbers, and then you'll see that, yes, positive right here. And this stuff right down here is telling you just present, positive, the different levels. Again, that's not us for kind of, to be experts in. This is what we're seeing right here, though, right? Is that methamphetamine, the sweat was positive.
Yeah.
Versus this one.
This one is a positive, but this one is a positive for an ADHD medication. So she is supposed to be on it. and they know that that's positive, so that is not considered an actual positive on that case. And just from knowing this person and having all their results, the number is right around the same every time, but it is not the exact same every time. That is not how ADHD medication works. So it's right around there every time.
I think one of the things that folks get confused about is that they see amphetamine and they think methamphetamine, and it's not. So you'll see here amphetamine and methamphetamine, you know, they're broke out. They're very different things. And so when you're seeing positive for amphetamine, it does not mean that they're using methamphetamine. Like in this case, yeah, the ADHD medication is making the positive for amphetamine.
Yes.
And this one here, is this a UA or what?
Yes, this is sorry, yes, this is just a basic UA. Yes.
Is ADHD medication and
Yep.
And yeah, so
yep,
so
it's an
most
amphetamine. Yes.
ADHD medications are amphetamines. There's a couple other categories, but most of your normal ones that everyone's on, Ritalin, Adderall, what's the third one? Vyvanse, thank you. I think there's a fourth one, all amphetamine.
The other thing right here, typically, if they are flushing or trying to, you know, flush their system, your creatinine level, that's what they're looking at to see if they're flushing.
That's the thing that's not in synthetic urine, that's in our bodies.
That's in creatinine.
That's how they tell.
Yeah. So if it's acceptable versus not acceptable, they're going to say, hey, you're trying to flush your system, and that's a positive.
Yes. Okay. That is so blurry. This one is a hair follicle test. Yes.
Yep. You'll see up here. See up here where it says hair?
Yes. And so this is an actual positive from a hair test. I know that one's sorry.
I mean, I can get it too. I'm sorry.
No, well, I'm sure there's a way, but
which can show at the top of this plus
where?
the very top of the plus.
Above the big black fly.
Thank you. I don't know what you're talking about.
Oh, thank you.
Oh, okay.
Or pretty good.
Then it gets kind of blurry.
So they can see the rest.
Okay, so anyway, you'll see up here where it says hair. Right. And you also see like this is not a company that we normally.
No.
How do you make it smaller?
It wasn't this company is not from here actually. That's why. So this was done. This was done in a different state. But this was a hair follicle test.
Okay.
And this part, so that part of it on most hair follicle tests looks almost exactly the same. Just the company's different.
It's a cutoff meaning.
So I believe, I don't want to comment on that because I'm not exactly sure. I only know what I think I know.
So
the last one said present with the lower amount and positive was at 10.
So that's what they're going to use for the lab to make sure it's enough in this system. Like if it's below this amount, then they really can't say it's positive. Like there's not enough.
Could have just been exposure.
Correct.
Mouthwash.
Correct. Right. So with every test, there's going to be a certain cutoff level. Above this is going to be positive. Below this, they really can't for sure certify that it's positive.
Yeah.
I actually had one case where the dad in the case kept showing up with trace amounts of meth in his system. And he worked at, I don't know what at some sort of warehouse or some, whatever. And he insisted that he was not using and that he felt it was the work environment. And when he switched to a different job, we weren't getting those readings anymore. I've also seen where they have some drug testing facilities are more sensitive than others. And so I've seen where they've switched somebody to a different drug testing facility, and then it started coming up negative.
Yeah, makes sense. Just the different levels. Yeah. Here's one last one.
Yes.
The buprenorphine.
Talk about this.
So yeah, again, I think you're going to see this, right? They're on that medical assisted treatment. Are they prescribed this? But what they're going to be looking at, and we had a case like this, are they using it appropriately? Are they worried that they're somehow abusing it or taking too much? And again, that's where your treatment provider is going to be watching that. Is it coming out with the right, measurement that it should be, compared to their prescription? Again, that's not anything for us to be kind of worried about or analyzing. That's not our role. That's definitely more the provider's role. But you're going to see positive. And again, that doesn't mean that they are going to have sanctions or held accountable, because we know that they're on that medical assisted treatment. But what they are going to be looking for is making sure that it's staying within the range that it should be compared to what they've been prescribed.
And
So-
I'm guessing there that cutoff means anything below that could be environmental exposure, could just be
Right.
being near somebody.
Yep.
Was getting high or
Yeah.
that kind of thing.
Trigger.
No, this is for somebody on Matt.
This is something that you use to stay off of meth?
Correct.
Yes.
Okay, it's for
Yeah.
that mat.
Yes.
Treatment approved.
Yeah.
Alternative.
Okay, we're gonna fly through these
Not
because
meth, opioids.
these next 7
But
minutes.
just hold questions to the end
Yeah.
because I do need to get through the slides. They may go over. And I will send out the recording by the end of the day for those that registered. So if you have to leave, please leave. But know that they may go over. And if you could just hold your questions to the end. Thank you.
Perfect. Okay, so what UA results can tell us. So obviously, what we've been talking about this whole time, right? We're chasing the P. It's going to tell us if there was a substance present at testing, patterns over time when testing is consistent, right? And then sudden or unexpected changes. And so trends are more meaningful than that single result, right? So what is the trend telling us? What does the last month look like? Not just that single use, okay? What they can't tell us, it's not going to tell us why they're using, why they're not using. It's not going to tell us their level or commitment to recovery. And it's not going to give us that parenting quality or safety of the child, right? So kind of going back to the idea again that drug use, substance use does not equal, lack of drug use doesn't equal safety. And then drug use doesn't always mean that there's a safety issue. That's why you see that children and parents still have that right to visitation. Parents are still going to be visiting their child even if they continue to use, because they're looking at that safety piece. If they can continue to be safe and have that visitation and that parenting time while they're safe, it doesn't matter that they're positive, because positive doesn't equal unsafe and negative doesn't equal safe. Okay. So this is what our focus is as CASAs, right? We got to focus on the behavior over the results, right? We're advocating for the child's needs, not just test results. So what we should be looking at is parenting behavior. Are they engaging? Are they consistent? Are they providing that structure, that safety? What does that parenting time look like? What is visitation notes saying? Are they showing up? They're engaging, they're being appropriate, they're awake, they're interacting with the child, they're demonstrating that all the parenting skills they're learning in those parenting classes, that they can put those to use, right? We're looking for behavior change from these parents, not just checking off the boxes, not just going to treatment. Stability and follow through. Are they going to treatment, right? Are they showing up for the UAs? Are they making their appointments? Are they making progress overall in their case plan? Bond with the child. So again, child's emotional response and connection. What is that looking like? And then context around the UAs. This is, again, there's always a story behind it. What are the barriers for them getting to UAs? What does their mental health look like? Is there fear around it? Transportation, maybe they're just missing UAs because they can't get there, right? And that's where encouraging, them to talk with their treatment provider, the treatment provider talking with the caseworker or the judge. Is there a different test that we can be putting them on? Because I can't get there. And every time I can't get there, it's showing up as a positive because I can't get there, right? So how do I show that I'm not using? So I think some important reminders too, recovery is not linear, right? We know that there's going to be ups and downs. There's going to be, most likely relapse. It's not just, okay, once I'm on this road, I'm going to go. And like we've been talking this whole time, it's very individualized, right? So you may go, unfortunately, we've seen it where parents, have been clean for like 6 months and they get their kid back, and within a couple weeks, unfortunately, right, they relapse and the kids come back into the system. We know it's a full of ups and downs and it's not linear. It looks different for everyone. So like we've been saying this whole time, what does their support system look like? How long have they been using? What substance are they on? I just already have been saying this, right? The positive UA versus the clean UA. We're looking at that safety piece. We're not, again, just looking at the P. UA should never be weaponized. And I know this is hard. Again, what is the story behind the story? What does the relapse look like? Is there certain patterns where we're noticing every February they tend to struggle? Okay, maybe they don't realize or recognize that something subconsciously, that's when I lost my child. That's when I lost a parent. What's triggering that, even subconsciously, for them to maybe relapse or to use? So missed or dilute tests may indicate other challenges. So again, going back to that, is it transportation issues? What else is going on with this person that may be causing those dilute UAs or those missed UAs? So again, we're looking at behavior, not necessarily the P. Okay. So here's some practical questions for you guys to ask. What do I observe in parenting behaviors? Reading those things. What does that look like? Are they showing up? Are they being consistent, right? Visitation is one of the biggest indicators of whether reunification is going to occur or not. That's what we should be looking at. Are they showing up? Are they visiting their child?
And what does the visit look like?
Yeah, absolutely. What progress have I seen over time? Yeah, so yes, in the beginning, right, especially now that we're getting on these cases a lot sooner than we used to, you're probably going to see a lot more anger, justification. You're going to see a lot more emotion up front. But what progress have I seen over time? Now that, yes, I've realized I have an issue. I've realized that my mental health is, going into my substance use, or I'm using because of, whatever. So are you seeing progress? Are you seeing that engagement piece? And what does this child need to feel safe and cared for? Again, we're here about the child. So when we're actually going to talk about, what to put in your reports, but that's what we've got to focus on. What does this child need? Yeah, they need that stability, right? So not just a clean UA, but what are we hoping behavior change looks like? They're stable. They can provide that safe and appropriate housing. They can provide for the child income wise, right? They can make safe decisions on who they're allowing around their child or not. Again, what does the child need? Yeah, they don't need just a clean UA, but what behavior do we need to see from that parent in order to provide that safe environment for the child? So bottom line, right, we gotta flip the script. Child-centered focus. UAs are tools, not a parenting test, right? Just because you're positive or negative doesn't make you a good parent or a bad parent. They're tools, not a parenting test. We are not, nor should we be the experts in analyzing UA results, right? None of us have gone to the training in school except for one, right? And so looking to the experts in this, what is the treatment provider telling us? What are they saying, as far as what that looks like? It's the CASA's job to report observations, not just test results. So one of the things that I know in recovery court, they don't want us to be reporting out, okay, this is what they're doing in treatment. This is how many UA positives. This is how many UA negatives. But overall, are they engaging? Are they not engaging? And so we'll actually have some examples for you guys here in a little bit. But again, focus on the relationships, behaviors, and that child well-being, not on test results. Okay. It's kind of like just treatment in general. Going to parenting classes doesn't make you a good parent, right? Going to this doesn't mean safety. Treatment does not equal safety. What we have to see is, are they implementing what they're learning in treatment? Are they able to demonstrate that over a period of time? Anybody can go to treatment. Anybody can go to parenting classes. It's a whole nother thing to actually implement that into your life. So how to document reports. And again, this is coming out. Focus on patterns, not every test. Report significant changes. Have they always been positive? Now they're negative, or unexpected results. Summarize the trends. Over the past month, testing has been consistent or inconsistent. Simple as that, right? Prioritize behaviors over numbers. Instead of parent tested positive again for whatever on this date, this date, this date, this date, use parent continues to engage in treatment and has maintained consistent visit attendance. Substance use remains an identified area of concern, and testing has shown ongoing use. A very simple way to highlight that, right? Document their engagement in treatment. Are they attending treatment? Are they working with a sponsor or therapist? Are they showing insight into the recovery? Are they following through with recommendations? Again, parenting behavior observed. What does the quality interaction look like during visits? Are they responsive? Are they attuned? Are they on their phone the whole time? Or are they, being present? Yeah, are they sleeping versus being present with the child? Do they seem to have that emotional connection and that bond? That's what we're looking for. Note context without excusing or judging. So here would be an example. Parent reported transportation issues contributing to missed test. Parent expressed increased stress related to housing instability. Again, if you're not getting your basic needs met, and we were just talking earlier with Alyssa and Alicia, the holidays are coming up. That's a very stressful time for a lot of these families. They don't have their children at home. It's been an issue. And now all of a sudden, they're also not going to have court for the next 2 weeks. There's no accountability. This next few weeks is going to be tough for our parents that are struggling with that sobriety, or depending on where they're at in their recovery. Parents stated they are working with their treatment provider on relapse prevention steps, right? Again, what is that behavior? Keep it objective and clear. Don't diagnose. Don't make assumptions that parent is lying or the parent must have used. Over-reporting prescribed medications. Use instead according to treatment providers, or testing records indicate, or I observed. Again, we don't want to be making assumptions, right? I think I already put this in there, so I'm gonna go that. Okay, so we're gonna do a learning check. Okay, so kind of quick interaction. So scenario 1, a mother has 3 clean UAs in a row, but she's missed 2 visits and the child's upset about it. What would you report on this case? So mom has 3 clean UAs, she's missed 2 visits, and the child's upset about it. How would you document this in a report? Any thoughts, ideas?
Testing results indicate mother's testing negative for drug alcohol use. However, mother has missed 2 supervised visits with the child. The last 2 supervised visits.
We have from Elise, behavioral, however, is still an issue.
Yeah. Right. And really focus on that child, right? Maybe it's the child's wishes, like, hey, right, mom, like you've gotta like, little girl misses you, little Sydney, right? Just, it really upsets her. When, yeah,
If
or
you're not going to be able to make it, it's critical that you let people know ahead of time so that the child's not waiting for you.
yeah.
Is it better to put the not visiting before the drug testing? Which is the better one way or the
Yeah,
other?
I don't think it necessarily matters, but really the big focus here, right, is the missed visits, right? That's going to impact the child more than anything. Yeah, the UAs, right? The child doesn't know anything about that, but what the child does know is mom isn't showing up to our visits. That's what child knows, right? That's our concern. That's our worry, is that mom's not showing up to these visits. Why is she not showing up to these visits? Does the clean UA automatically mean progress? Not necessarily, right? Something's going on, right? Exactly. Yeah. So, yeah, not necessarily. And then we talked about what matters most for the child right now is that mom's not showing up to her visit. That's the biggest thing right now. Okay. How about if father misses a UA? He tells you his car broke down, but you don't know if that's true. You notice he's been consistent in services and engaged in visits. What could you explore or observe before drawing conclusions? What would you do if this was your case?
Well, either way, you don't freak out about it, I don't think.
Well, ask him the reason why he missed the UAs.
Well, my car broke down, right? Okay. But yeah, tell me more about that, right? Like,
Are you getting it fixed?
yeah, does he need help getting it fixed? Is that an I'll help thing? Does the caseworker know?
What other ways can we get to our UAs?
Exactly. Lots of times the treatment providers can come and pick up folks, or they can go to the house, right? So you'll often see a lot of times in your removal affidavits that they actually call Friedel to come to the house to test folks at the house. They try to remove any barriers possible for the parent getting there for testing. And so they will travel, right? So yeah, optimal no focus on, right? Again, what would you focus on in this one? The missed UA or yep, he's consistent in services, he's showing up to his visits, he's doing well in his visits, right?
They may have maybe a little disruption for a short amount of time due to a broken down car.
Right, exactly. But somehow he's getting he's getting to those visits, he's figuring that piece out, right? And he's getting to those services. That's the focus. Okay, behavior versus results. A parent continues to have low-level positives for THC, but has stable housing, consistent visits, and a strong bond with their child. What does this mean or not mean for safety?
Still appears to be safe.
Yeah, so they have stable housing, so they must be holding down some kind of income, right, or job. They're showing up to their visits. They're doing really well with their child in those visits. What would you highlight in court for this one? What would be in your report for this one?
Moving forward with their parenting. Doing well. With maybe keep an eye on THC levels.
And that's the hard thing, right? Is it's illegal. Do they have it locked up, right? Where are they using? I mean, that's the hard part. THC is so hard. It's kind of like the alcohol piece, right? It's like, how do you measure at what point you're unsafe? And that's where you have to look at these things. Okay, is there THC or just like their alcohol use? Is it showing, unsafe? So what does it look like around that use? How is that impacting the child or is it not impacting the child? And that's a hard one. THC is really hard. It's just like alcohol.
And I think another one that's good with this one, just specifically for THC, is it is illegal for it to be in any arm's reach of a child. So,
which is really important given the fact that we now have edibles that come gummies, cookies.
So it is illegal to be in the arm's reach of a child.
Yeah.
So where is it? Yeah, when you go to that home visit, right?
So just sitting on the coffee table, maybe let them know, hey, gotta keep it out of arm's reach.
If somebody has a prescription for medical marijuana, are they allowed to do that during their treatment, or is that?
Not if it's federal treatment, because federally marijuana is illegal. Yeah, so any
And
federal treatment, you are not allowed to.
So recovery courts, no. And typically CPS, once you're involved with them, they have a no substance use kind of
But
standards,
somebody on
right?
probation, most of the probation and parole officers in Yellowstone County don't report the
And I've seen a lot
hot
of
UAs for
judges
THC.
that don't really lift
Mhm.
much of an eyebrow if it's just THC. Even if the parent is supposed to be.
But I know recovery court, absolutely not.
Yeah.
From what I know.
But if that's the only thing popping up, I don't think.
And that is where a level would be really interesting to look at, because if they're maintaining a low level of THC, they're not using very much.
Which, yeah, I mean, again, sometimes you have to kind of weigh that, right? Am I on the medical marijuana to control my pain versus being on prescription opiates, right? Being on a fentanyl patch, being on a, right? Yeah, kind of looking that, and that would probably be something, to discuss with their treatment provider. Yeah. Okay. Questions. Now we can open it up for other questions. I know it's 11:08, so if you have to leave too.
One thing I did want to mention just before questions, is sometimes remember that these people's lives are absolute chaos. So sometimes when they're passing all their UAs and they're doing really well, that's really calm, quiet peace for them. That's terrifying. Whereas, having positives, people are coming at them. There's interesting things going on. It's keeping them going. And sometimes that is another perspective to take, because it's really tough.
So they're not used to calm and quiet
Yeah,
and peaceful, and
yeah.
that is a hard feeling for them.
Yes. And sometimes they'll create their own chaos. Yeah.
I think we see that a lot of times with our kids as well that come into care, right? Again, if they're used to living in chaos and now they're in this safe, stable foster home or placement and
They'll
it's
act
too
out.
calm, they'll act out. They'll
Yeah.
create their own chaos because that's what's normal. That's what they're
That
used
makes
to.
them feel comfortable. That's
Yeah.
their structure.
Aaron liked your point.
Thank you, Aaron.
Yeah. So other questions, I mean, I'm hoping, like I said, and Denise, hopefully we answered that question for you too. Again, like I said, that we're truly looking at behavior and what do we focus on? Like I said, what is impacting that child? What is the child aware of? What does the child know? Looking at it through the child's eyes, because that really is our role. Like, again, we're not LACs. We're not here to analyze. We're looking at patterns, but we're really looking at more of, okay, how is their use, or is their use impacting their ability to parent this child and provide that safety for that child? That should be what we're focusing on in our reporting. That's what we should be focusing on with the child, with whatever we're reporting out, is not necessarily, again, chasing the P, but what is their behavior telling us? And that's up front, even with the new laws, guidelines with child welfare, they cannot remove for drug use alone. They have to show the impact on the ability to parent.
So you have a question from Ann Cole. Could a low level of THC mean a partner or friend is using and a parent is not?
Not usually.
Like, would you
You'd
come
be
up
like-
positive for THC, Kourtney, like if it's environmental exposure?
Not-
Somebody smoking in front of you?
Not usually. You have to be like in a car, it's definitely not just something.
Like, is hot boxing really a thing? Like, can you be smoking and like somebody else?
Yes, that you
Okay.
can.
Okay,
Yes.
so if you're sitting in a
Yes.
closed up car and your partner's using, you could potentially be positive
Yeah,
for
but not
marijuana.
just standing outside. No. Good question.
Yes. Hopefully, Anne, that answered your question.
I've never, like I said. Anyway.
I don't think anyone was questioning you, but thank you for that.
Just if hot boxing was actually a thing.
Yes, that's real. Or was, I guess.
I'm just curious on how we really know what their behavior is like, because, we're talking about, sometimes people drink alcohol, they can be really neat, and sometimes they're not.
Yeah.
Same with THC. THC can cause, people to be very agitated or aggressive, but it might not. And so, would you necessarily see that in the visitation? Does that come out? Or, because they're publicly being watched with how they interact with their kid. Are they?
So you're kind of asking, like, someone who's continuously using, how do you kind of
like what's normal, what's appropriate behavior versus just them?
This is a safe person for the kid to go. And if they do, is it like a slow transition if they do end up living with them, or is it like, okay, we feel they're safe and they're just like still living with them? I don't really know how it works.
Oh, I know trial home visits are 6 months, right?
Mhm.
So they do a
Wait.
trial home visit for at
Mhm.
least 6 months, which means they're checking in constantly. They're keeping eyes on that child. So that's really good way to avoid that at all costs. And I've seen a lot of trial home visits that go for a whole year. So I think that's the best way that CPS handles that part of it. But again, and this is where everyone's recovery is different. You can have someone come into recovery and the parenting part is easy for them, learning those skills, gaining them, but maybe the sobriety is harder. So they're doing great here. They're just struggling keeping sober. But when they're around their child, they're present, they're there, and they want to do what's best. Whereas you can have someone who's passing all their UAs who doesn't give a crap about learning these skills. Right. And so I think that plays a lot into it. And so maybe those skills will come first for that person, and then their sobriety will come next. And that's okay because it's different for everyone. Whereas, the person who's passing, but the parenting skills aren't there, is that what's best for the child? No, yeah, they're passing their UAs, but they're not doing anything to become a better parent.
Yeah, I'm just
So-
curious on how we really are able to see like what.
Okay. So I think Teresa too, like I had a mom that she had used for so long, her brain, her mental capacity, because she had used for so long and caused so much brain damage at that point, even though she wasn't using, right? Her
She
testing,
appeared like she was using.
her testing was telling us she was clean, but her behavior was like she was using. That's again where we looked at the behavior. She was not safe to be around her children anymore at that point, and so we could not reunify her children with her in that particular case. Like she was, I mean, she's probably one of the ones, honestly, that made me nervous that she would show up at my house and hurt me or my children. Like that doesn't happen very often, but like her behavior was so unsafe, even though she was testing clean, like she wasn't even allowed to come back behind closed doors to meet with me anymore. Like I had to meet with her in the lobby because she had just done so much brain damage. And that's where it's hard sometimes. Like, is it mental health? Is it substance use? Is it damage to the brain where things have just happened for so long and so bad? What we had to focus on is, again, not the UA results, not the engagement and treatment, but the fact that she was not safe for her children. And that's what we had to focus on, is that behavior, regardless of the reason or the cause for it was mental health, drug use, whatever. Her behaviors, she was not.
And I think as the advocate,
yeah, exactly.
But that's not the only time you can or should be meeting with the parents either. Like if you have a good relationship with them and you're moving along, you can kind of see those behavior changes. And if they are using a harder substance and they're using it so low that they're functioning correctly, I mean, that just doesn't usually happen. So that's more rare. You're not, if they're on something hard, you're gonna know. Yeah.
I don't have my phone. Oh, yeah. Does he just know I'm in training? Yeah. You have a question on that?
Just Aaron pointed out in the military, it is their responsibility to be safely away from any type of drugs, and to not test positive. So.
To kind of putting on that expectation of, who are you surrounding yourself with, right? And I think that's a big one too, that we talked about earlier. Again, is their behavior, who are they exposing themselves to? Who are they hanging out with? What does that support system look like? All of that kind of plays into that long term. And that's where sometimes those tough conversations have to happen, is like, I can't be with my mom anymore because mom or grandma in this case is using too. Right? Or we have actually a lot of resources available for you guys too on codependency and recovery. Right. And so if both parents are using and one is more committed to the recovery than the other, I mean, what is that going to look like relationship wise for you? Right. And so choosing, maybe family, spouses, supports. And again, that's a huge ask, right? Like anybody in your support system now, I'm saying is not appropriate or safe. You have to start all over with your support system. Now you're in recovery, you have no support system, you're trying to parent this child newly sober. The kid doesn't like it because now all of a sudden mom cares what I do and what I don't do. And so, right, there's a lot going on for these families. We think, and it is a positive when they're in recovery and they're sober, but that's also a lot of stress. Things look very different, me parenting sober versus when I was, right? Kids are probably going to argue a lot more. Like, again, that's kind of high stress level. It's awesome and it's great, but it's also high stress level for these families. Yeah.
So, and I should probably look at what the courts have ruled about this, but so what I hear you saying is the courts are taking the position that children observing regular drug use in the home is not a problem unless there is a safety concern. So you can be in a home where a parent is, and I don't know if there's like a delineation between, okay, well, the hard drugs, that's a problem. THC and alcohol, that's not a problem. But if you're in a home where your parents are getting amped up all the time on something, the courts are saying, that's not really a problem. Like, we're not concerned.
You're typically going to see though how it's impacting their ability to parent. So maybe they're not getting their child to school because somebody had to have noticed something to call in that report to child welfare, right? So it's leaking out of that family somehow, right? They're not able to hold a job. They're homeless. Which homelessness itself is not abuse or neglect either, but again, it's usually going to lead to something that is impacting that ability. Or then, like I said, they're going to test the child. Is the child positive? Is the child not coming to school? Is the child coming to school hungry? Is that something is going on and it's leaking outside of that house where somebody's concerned enough to call in that report? So it is impacting that child somehow.
So the courts want to see like a secondary causation, like yes, drugs are present. However, this, and this are happening.
Yes.
As a result of that.
And legally, it is not illegal to be high. It is not illegal to be high. That's where they run into a problem. It's not illegal to be high. It's illegal to have substances on you. You can't be drunk in public, but it is not actually illegal to just in itself be high. And that's where they run into the problem.
Are they driving, right? Do they get in a wreck
Then
and they
it's
get
illegal.
pulled over?
If it's in front of the kids, then it's illegal.
Right. Then you have the impact.
It's illegal, yes. Yes.
So that impact, right? So if you're driving and you get pulled over and you, right, that's impact
You
on
have to
child.
have a perfect drug addict who steps outside, takes their meth pipe, lights it in front of the community,
Right.
then make sure they're clean, goes, and how many times have you ever heard of that? I never have, personally, in my,
Okay, thank you for
does that make more sense?
because I was
Yes.
like,
It is illegal to have meth in front of it's illegal for, yes, yeah, but it's not illegal to be high, yeah, and so that's where,
so it's just more about like when people are arrested, is there like, I mean, it's all due
Yep.
process stuff. So
yes, yep, and that's most states, I don't think there's any state where it's illegal to be high, because that would be so harsh and just so much drama if they tried to do that.
So in reality, is it probably happening more absolutely with families that aren't involved with child welfare, right? Because at this point, they've maintained it within that family so far where it hasn't gotten out, where people aren't concerned. That's the big thing is you have to show that impact on their ability to parent. You have to show the impact on the child. So I think even another example would be like, yeah, if I choose to use, whatever, right? But my kids are over at grandparents' house and I don't bring them back until I'm already clean and it's out of my system and I'm maintaining a job, I'm maintaining my housing and stuff. You can't show that my drug use on the weekends when kiddos are with whoever is impacting my ability to parent them.
But that would be extraordinarily rare.
Exactly.
Like,
Exactly.
it's not-
And in that case, is the child better off with them? Maybe, because there's all these other alternatives, you know what I mean? And again, very, very rare. So I'm glad you asked that, because I think that helps a lot, yeah.
Other questions, I know we're way over, but I also want to be here to answer your guys' questions too. Because this is, like I said, this is impacting almost everybody's case. I don't know that we have any cases right now, maybe one or two, that there's not substance use involvement, but
And usually if there's
Yeah,
not
yours.
substance use,
very rare,
it's
the
severe mental
exception.
health. Yeah.
Yeah, the exceptions to the rule here, but
I'm always the exception.
yeah.
What about coffee?
Huffing, like you're talking like the spray paint huffing
Yeah,
or the canned air.
or whatever. It's difficult to detect, right?
You can't detect that I know of. Not unless you're using something specific.
You're
But
gonna
I
usually see behaviors with
Oh
that.
yeah, but also so huffing is a very short-lived high. It's very intense and it's very brain. And usually it's kind of, wah wah wah. They usually end up passing out. A lot of them will urinate on themselves. It's a very quick and instant. You can do it from, like you said, the whipped cream. That one's not as accurate as people think it is. The air dusting spray is a really, really common one, really, really bad for you. And then paint, yes.
Yeah,
At a coffee shop and where they
yeah.
They
the
were
whipped
inhaling
cream.
coffee. Oh, I was like, that sounds
The whipped cream,
delightful.
yeah.
We're all
Okay, got it.
The
I
whipped
love
cream.
smelling coffee. Yeah. That one's not as common anymore.
The last time I saw
Yeah.
that was actually in Seattle on the streets. We walked by somebody that was huffing out of a paper bag, the spray paint, right? So
Yeah.
but yeah, they're
And they
homeless,
kinda-
right?
yeah,
You're
they
you're
usually
seeing
kinda
how it,
fall over for a while.
Yeah.
It's very terrifying.
Mm. Oh, the cans, yeah.
They caught it from a drug test or from the cans?
How did you know that the
Yeah,
mom
how
was
did
using?
they?
We didn't.
Oh, so how did you end up finding out? Oh, you didn't. Okay.
We saw the cans and
Oh,
Okay, yeah. So I was gonna say, I don't think
Gotcha.
there's a way to detect for that.
Yeah. Yeah.
Yeah, that's scary
Did you
though.
have a
That's
question?
not something to mess with.
A comment? No?
They doing, they're not just eating the whipped cream. No, it's the.
Like after it's done.
No,
okay,
so
after
the
it's
so the
empty.
whipped cream will still be in there, but the air will be out, like the whatever that is, CO2. I don't know what they put in there, and so it's all like funky then after that. So the whipped cream's still in there. They're not utilizing the whipped cream. They're spraying the.
I don't even know how you do that.
Yeah. You keep it down. I've never done this. I just want to make that very clear.
You sound like
Because of what I've done for work, but they'll hold it down and spray. And if you do it just right, the CO2 or whatever chemicals in there gets to your
So
head.
the whipped cream won't come out.
No, it doesn't
Okay.
come out. No. Sometimes
Everyone's
it,
gonna
like,
go home and try this.
no,
stuff.
please
No.
don't do that. It's not good for your brain.
That's gone for her.
No, yeah. So you just hold it up and you're not actually utilizing the whipped cream at all. So that's how they would know that.
Some husband works at the ranch.
Of whipped
They
cream,
gotta
right?
like freeze his face to the carpet with the
Mm-hmm.
air spray.
Yeah.
Yeah, it gets cold. Yeah.
So I got it. Somebody was not.
Yeah.
They're not. It's just gonna be normal.
So I think the big thing again, I think, peer coordinators, when you guys are writing your reports, when you're checking reports again, are we focusing on that behavior? Again, not so focused on the drug testing, so focused on the UAs, but what is their behavior outside of the UA telling us? What does the child know? What is the impact on the child? That's what we're really looking for in those reports. Are they engaging in treatment? Are they building up those healthy, positive coping skills? Do they have a healthy, positive support system? Are they showing up to visits? Right? That's what we should be focusing on as CASAs.
And I think a big thing to remember too is relapse truly is a part of recovery. As much as a lot of people don't like to hear it, or some people think they use it as an excuse, it really is. Relapse is a part of recovery. And the best thing that advocates can do is just come alongside that parent if it's healthy and really help pick them back up. If they fall off the horse, that's what they need to learn, is that if you fall off the horse, you don't disappear for 2 weeks and continue doing it. You get right back on that next day. And that judgment that they feel, if that's taken away and they've got this CASA that cares so much about their child, but also them, because them getting better is what's best for their child. And if you can come alongside that, then, I just think that makes a huge impact. So.
Are the kids ever in? Because you said going out, kids test positive, are they in recovery too?
No, so typically for the babies, obviously they'll keep them in the NICU, right? And they'll give them, sometimes some medical assisted treatment. Luckily, most of the time, right, the kids, the levels aren't high enough. It's more exposure, right? And so just monitoring and watching that.
Yeah, and it's a lot more with our littles. So the short-term exposure, of course, is way better than long-term. So I'm hoping CPS would watch
Now, if
that.
you had a
look for any
teenager that was
concerns.
using, absolutely,
Yeah,
they're going to be in
gotcha.
their own treatment.
It's not. Been 12 and using the.
So they're going to be in their own treatment. Yeah.
Yeah. And that is another thing I always try to give people this aspect from a client I had that I've just always remembered. I had such a hard time with her and getting through to her. And finally I asked, when did you start using? Like, what was the first day you ever used? She was 6 years old sitting on the couch with her mother, and her mother just handed it to her. And from watching her that entire time, she knew exactly what to do. And from that day on, my perspective on addiction being a disease has forever changed. And I 100% believe that, because how could you live a life if that's all you were gave? So, yeah, I think it's just good to keep different perspective when it comes to it. Yeah.
Thank you guys. I mean, yeah, if you guys ever have any questions, you guys know how to find us and get a hold of us, or, hey, what does this mean? But again, we're not LICs. That's not our role and responsibility. Just focus on the kiddos. I'm not an LIC. No,
I was just kidding.
no, she is.
Was. If you guys ever have any drug questions, I am open.
I'm gonna stop recording.